Alrighty, guys, we're going to do a lecture on chapter 5 in your medical terminology book. It has to do with the integumentary system. So this will be done in two parts. We're going to go about half and half, and then there will be 3 assignments attached to it that you need to complete. So chapter 5, the integumentary system. So what do you think that is? Anybody want to take a guess? It includes a few different things. Okay, so maybe not something that you would normally think of, right? But what it includes is your skin, your nails, your hair, all that kind of stuff. Okay. So when it comes to the skin, we have different functions. It helps to protect us. It's kind of that largest living organ, right? It's your kind of first defense against things. Melanin in your skin provides color, right? So everybody is a color, right? There's no like white as paper. I tell people sometimes I'm translucent because I'm kind of pink, right? But pink is a color. So the more melanin you have in your skin, the darker you are. Your skin helps to regulate your body temperature. It serves as a sensory receptor, so we're able to feel touch, pressure, pain, temperature, that type of thing. It provides for elimination of body waste through perspiration or sweating, right? And it's our first step in synthesizing or synthesizing means like processing, right, of vitamin D. Okay, so vitamin D. Anybody know where vitamin D comes from? If it's on our skin, if we're synthesizing it through our skin, comes from the sun. Okay. So the integumentary system. The skin is also called the integument or cutaneous membrane. So we have the epidermis, that's the outer layer of skin. So that's what you see, right? And then the dermis is the inner layer of skin. And then we have a subcutaneous layer, which consists largely of loose connective tissue and adipose tissue. Okay, so that's kind of like those fatty layers, right? As skinny as somebody can be, they still have subcutaneous layers, so it's kind of that fleshy part of the skin. If somebody studies dermatology, if somebody's a dermatologist, that's the study of the skin. And then we have accessory structures, so that go along with our skin, which is hair, nails, different types of glands, things like that. Okay. So this is a good little diagram of a little portion of skin and hair. Okay. We have nerves that run kind of in and out, right? So if we like touch our arm, we're able to feel that because of nerves, right? These are the red one's an artery and the blue one's a vein, right? Because there is little capillaries and veins and arteries under and around our skin. This is a sweat gland. It looks like a little bundle of stuff, right? So it's the sweat gland that kind of goes up and to the surface of our skin. And this would be considered a sweat pore. Okay. Let's see. There's all these different layers. So this fatty layer is that subcutaneous layer. Okay. And then we have the dermis, which is right under here. And then we have the epidermis, which is the outer layer. Okay. And then here's those sensory nerves. Let's see. This is considered a sebaceous gland. So this is where the hair starts to grow, right? This hair follicle, it starts to grow and come out of the skin. And these sebaceous glands kind of provide lubrication and like they kind of oil that kind of stuff up so it's able to move pretty freely. Sometimes a sebaceous gland can become plugged, right? So then think of like acne or pimples or little cysts, those type of things. Okay. And then here's the structure of a nail. So this is the lunula, right? So I always think of a luna, which is a moon. So this is like a half moon here. This is our cuticle. Okay. This is the nail of the bed, which is under the nail. Okay. This is the nail body. And then we also have the free edge of the nail. Okay. So true or false, the epidermal layer contains most of the skin's vital structures. So epidermal layer contains most of the skin's vital structures. That is false. Good. So it's the dermis actually that contains structures such as the hair follicles, pressure receptors, and glands. Another question, the half moon we see at the base of our fingernails is called that would be B. The lunula, right? So it's derived from the Latin word luna, which means moon. All right, so then we have skin lesions. So skin lesions are things that happen to our skin, right? So like scratches and things like that. So an abrasion is a scraping or a rubbing away of the skin or mucous membrane as a result of friction to the area. So like a carpet burn or like um I'm sure people, messing around and stuff with your brothers and sisters or your cousins or something may get a carpet burn, but that's just kind of a rubbing away of that very top layer of skin. And then we can have something called an abscess. So this is a localized collection of pus in any body part that results from invasion of pus-forming bacteria. So an example of this is a pustule or a small abscess. So think of like little cysts or even pimples, things like that. Okay. Then we have a blister. So this is a small, thin-walled lesion containing clear fluid, also known as a vesicle. So think like if you, wear shoes that are a little bit too tight, you might get a blister, right? A small blister is known as that, and then a bula is a larger blister of the skin. And then we have a carbuncle. So this is a circumscribed inflammation of the skin and deeper tissues that contains pus. And then we have a comedo. So this is a typical lesion of acne, right? So a white head is considered a closed comedo, and a black head is considered an open comedo. And the reason it's black is because it's been oxidized. So it's been in touch with oxygen. So that's why it turns black or like dark brown. Then we have a cyst. So this is a closed sac or pouch in or within the skin. Um, it contains fluid, semi-fluid, or solid material. So an example of this is a hydrocele, which is a fluid-filled cyst, especially in the scrotum. So that's on little boys, right? And then an example also could be a sebaceous cyst, and that's filled. It's a solid filled cyst, so it has kind of that. If you've ever watched Dr. Pimple Popper, so that's kind of like a hard pop, right? So it may be kind of soft, but it's solid. It's not just fluid that's coming out of that. Then we have a fissure. So this is a crack-like sore or groove in the skin or the mucous membrane. So mucous membrane, the example here is an anal fissure. So that your anus is a mucous membrane, and sometimes with hard stools, constipation, things like that, sometimes you can get a little tear in that mucous membrane, and that's considered an anal fissure. And then we have a fistula. So this is an abnormal passageway between two tubular organs or from an organ to the body surface. So a good example of this is a rectovaginal fistula. So what that is your vagina and your rectum are pretty close together. So if there's a hole that connects one to the other, which can happen during childbirth, it can happen with lots of straining and things like that, then you could have vaginal fluid going into the rectum, or rectal fluid, which would be feces or poop, right, going into the vagina, which can cause lots of problems. So that's what a fistula is. And then we can have more lesions. We can have hives. These are circumscribed, slightly elevated lesions on the skin. They're paler in the center, and then the surrounding edges are a little bit darker, maybe a little bit more red. These are also called wheals. A good example of this is a mosquito bite. So this is the type of wheal that we talk about when we do the tuberculosis injection or the intradermal injection. So that's just the type of wheal that we talked about. A laceration is a tear in the skin. That's something that might need sutures, right? Macule, this is a small, flat discoloration of the skin. It's neither raised nor depressed. So these are things like bruises and freckles, things like that. And then a nodule would be a small, circumscribed swelling protruding above the skin. Okay. A papule would be a small, solid, circumscribed elevation in the skin. So an example of that would be like a pimple. A polyp is a small stalk-like growth protruding upward or outward from a mucous membrane surface, so like a nasal polyp, so it's like a little growth maybe in the mucous membrane of your nose, okay? You can get them in your colon, all kinds of different mucous membranes. A pustule is a small elevation of skin filled with pus, so that could be like a small abscess on the skin. And then we have scales, so this is a thin flaky part of skin. So it's kind of hardened epithelium, which is epithelials are skin cells that are shed from the epidermis. And then an ulcer, this is a circumscribed open sore or lesion of the skin, accompanied by inflammation. So it's just a little opening of the skin. A vesicle, which is a small, thin walled lesion containing clear fluid. So a blister, right? And then a wheal, which is that circumscribed, slightly elevated lesion of the skin, paler in the center, and then the surrounding areas maybe a little bit darker, a little bit more red or pink. So an example of that is hives. So question, notice that sometimes two different terms are used to describe the same thing. For instance, if a physician says a patient has hives, the patient also has, what do you guys think? We just talked about it. That would be D, wheals. So that's the official term, medical term, and hives is more of a layman's term. Another question, a patient has a rash consisting of both macules and papules. What would be the combined adjective form? What do you guys think? I'm going to say C. Yep, maculopapular is the correct combined adjective form. So remember the combining vowel is used because the second root begins with a consonant. So macule, right, and papular, so they combine this O right here. They put that O there to combine the words. All right, so now pathological conditions that have to do with the integumentary system. So acne vulgaris, this is a common inflammatory disorder seen on the face, chest, and neck, and the back sometimes too. It appears as papules, pustules, and comedoes. Then we have albinism. So albinism is a condition characterized by the absence, so there's no pigment in the skin, hair, and eyes, and it's an inherited condition. So if you've ever seen somebody that has albinism, they have like stark white hair, stark white skin, sometimes really, really light blue or even red or purple hazel looking eyes. Not hazel, I'm sorry, violet looking eyes. So Google it and look it up. It's pretty interesting. A burn. So this is defined as tissue that's injured by a flame. Could happen with the flame. It could happen with heat, chemicals, radiation, electricity, or gases. And then the extent of the damage is determined by the mode and the duration of exposure. So if it was just a quick, like, ooh, I touched the stove or I touched a hot curling iron or something like that, usually the duration of the exposure is pretty short. But sometimes if somebody might be, exposed to a flame for a longer period of time or something like that. It also is dependent on the thermal intensity or the temperature. Excuse me. Sorry, guys. And then the anatomic site of the burn also. So a first degree is a superficial burn. So this is something like a sunburn, or like I said, like maybe even like if somebody like touches something that could be considered a first degree burn, or it could actually go into a second degree burn, which is like a partial thickness burn. So an example of that is a flash contact with hot objects. So like boiling water or like a hot curling iron or an iron or something like that. And then third degree is a full thickness burn. And this is a deep burn, usually from fire, a third degree burn. Okay. And then we have a callus. So this is a common, usually painless thickening of the epidermis, so that very outer layer of the skin, at sites of external pressure or friction. So if somebody is like a weightlifter, right? So they may have calluses on their hands. I have like a little callus on my hand where my wedding ring kind of hits, right? Guitar players have calluses on the tips of their fingers, that type of thing. Okay. So true or false, the higher the degree rating, the deeper the burn. So is a 3rd degree burn deeper than a 1st degree burn? That's true. Good. So 1st degree is superficial, while 3rd degree is a full thickness. So then we have a basal cell carcinoma, or carcinoma basal cell, because there's a couple different kinds. This is a malignant, meaning cancerous, right? Epithelial cell tumor. It begins as a slightly elevated nodule with a depression or an ulceration in the center. So I actually had one on my arm. I can show you guys. I have a pretty distinct scar, but it started out as like a little like scaly little scab looking thing, right? And it just would never heal. So I went to the dermatologist and they cut it out, and it ended up being a basal cell carcinoma. So that's what that is. Okay, and then it's also defined as the depression enlarges, the tissue breaks down and crusts and bleeds, and the most common malignant tumor of the epithelial tissue is a basal cell carcinoma, and it occurs most often on skin exposed to the sun. So wear your sunscreen. Big advocate for that. So that's kind of what it looked. That's exactly what mine looked like on my arm. And it would like get caught on things sometimes, or like my shirt or something, and it'd start to bleed. And so they just cut it off. And then we have a squamous cell carcinoma. So this is when there's a malignancy of the squamous or scale-like cells of the epithelial tissue. It grows much faster than a basal cell carcinoma, and then there's also a greater potential for it to metastasize if it's not treated. So that means that those cells or that malignancy could travel to other structures, including organs and things like that. It is frequently on sites that are sun exposed areas, so like the top of the nose, the forehead, margin of the external ear, so kind of the back part of your ears, right? And then sometimes on the back of the hand, the lower lip, just places that the sun hits, right? So wear sunscreen. All right, so that's a that's a squamous cell carcinoma. So it's a lot faster growing than a basal cell carcinoma. And then we have dermatitis. So this is an inflammation of the skin seen in several different forms. It can be acute, so something that happens pretty rapidly, or it can be chronic, so something that kind of happens over a longer period of time. Contact dermatitis is something like if you were to start using like a new soap or a new laundry soap or something like that, you could get contact dermatitis. So that just means that it's something that's touching your skin that's causing it to become inflamed. So, all right, and then we have eczema. Anybody ever seen that little video where the little kid says, "What are all those little bumps? You got eczema?" One of my favorites. Okay, so that's an acute or chronic, so something that happens pretty rapidly or pretty quickly, or chronic, meaning it happens over a longer period of time. Inflammatory skin condition. It's characterized by erythema, papules, vesicles, pustules, scales, crusts, scabs, and intense itching. Eczema sucks, just FYI. But there's lots of great little creams out there, steroid creams that you can use. All right, and then we have, let's see if I can say this, Exanthematous, viral disease. So this is a skin eruption or rash accompanied by inflammation, having specific diagnostic features of an infectious viral disease. Examples of this are rubella, which is the German measles, roseola, rubeola, which is red measles, and then this erythema infectiosum, which is Fifth's disease. So if anybody's ever heard of Fifth's disease, it's a virus, right? And it can cause kiddos to get like rashes on their hands and the bottoms of their feet and their mouth, that type of thing. Then we have gangrene. So this is when there's tissue death due to the loss of adequate blood supply. It can be it can be caused by the invasion of bacteria. So then what ends up happening is there's a decay of enzymes that start to produce like a foul odor. So it's kind of stinky. There's two forms of gangrene, dry gangrene and moist gangrene. I hate that word. Then we have herpes zoster. There's all types of different herpes. What's the word I'm looking for? I want to say infection, but that's not the right word. So there's all types of different types of herpes. Okay. So everybody thinks herpes, oh my gosh, you have herpes, right? Like genital herpes, right? But that's herpes simplex 2. And then you have herpes simplex 1, which is above the belt, excuse me. So that's like if somebody gets really bad fever blisters, that type of thing. Herpes zoster is shingles. Okay. So, chickenpox is a type of herpes, right? So if somebody has had chickenpox in their lifetime, they can at some point in their life also get shingles or this herpes zoster. So what it is it's an acute viral infection. It's characterized by painful vesicular eruptions on the skin that follow along nerve pathways of underlying spinal or cranial nerves. The highest incidence is in adults over 50. I've had shingles before. I had it on my head. A lot of people get it like on the trunk of their body. So like their chest, their back, right? Maybe even their top of their buttocks, their leg, that type of thing. But it always is on one side or the other of the body. It doesn't usually cross over that midline of the body. So this is a good example. We saw this in another lecture last week, I think. So this is an outbreak of shingles. It's super, super painful. And then we have hyperkeratosis. So this is an overgrowth of the horny layer of the epidermis. So it occurs in a psoriasis and in the formation of calluses and corns. Okay. All right. Then we have impetigo. So this is a contagious superficial skin infection. It's characterized by serous vesicles and pustules filled with millions of Staphylococcus and Streptococcus bacteria. So it's super contagious. So question, the viral infection most commonly flares up after age 50 and follows along the nerve pathways. That would be letter C, also called shingles. All right. Okay, so I'm going to stop here and then we'll keep going after this one with part 2.